Our Safe at School planning group, we really kind of looked at it as a school diabetes task force. And it originally started because of concerns about kids not getting what they need at school. And we really wanted to be pioneers or in the forefront of making sure they had what they need. So we brought expertise in from the Department of Health, the Minneapolis-St. Paul Diabetes educators, school nurses, and ADA, as well as parents, to find out what we could do to make sure kids were safe in school.
Part of my drive to keep children safe at school with diabetes is part of my daily work with patients and families. I ask children every day, how is it going at school? Do you feel like you're getting the help that you need? Are you comfortable in your school setting?
What I found most special about working within this particular group is the tremendous dedication of all the people involved. We all came from different points of view, but we were all so committed to the end goal that we did come out with a product that really meets the needs of not only children, but their parents and healthcare providers and schools as well.
The role of the school is in taking care of the child with diabetes is key. I mean, they spend so much of their hours there. And I think first and foremost, their job is to keep the child with diabetes safe.
Throughout the United States, I think there was a push to try and really make sure things were mandated. And I think our goal was that if it's mandated, it's mandated, but our ultimate goal is that kids get what they need in school. So some of it was trying to get the right people at the table to make sure that we heard from physicians, from clinics, from families, from kids, from organizations, to make sure that what we were doing was really what was needed.
Over the years in working with this group, there were a couple of look how far we've come moments. And one of them was when Tara Kaup made the bold statement that school nurses really have to be the ones taking the lead in making sure that every student with diabetes has a 504 plan in place. A 504 accommodations plan is worked out between the parent and the school, and it lists all of the accommodations that a student with diabetes needs in the school setting. And so it covers things like assistance that they might need, whether that's with blood glucose monitoring or injections, or it might even be special accommodations during testing time, or help that they might need in the lunchroom.
One of the proudest moments I think I had is when we were able to pull together people from all over the state, families, kids with diabetes, physicians, organizations, to look at working on putting together something for the National Diabetes Education Program, helping children be successful in school, and really adapting it to the state of Minnesota based on what our needs in school are and what our model of care was.
One of the moments that I recall that made me most proud was when the Minnesota guidelines for management of diabetes in the school for nurses to use was developed and then implemented, and I was able to see actually the next school year the tools that were developed through that process actually being used in care of students with diabetes. That made me feel very proud that the work that this Safe at Schools group had done was actually being used. The word learn to me means that you are able to understand a concept, understand an idea in a way that you can put that concept or idea into action.
First of all, as a parent, I'd like to thank the other members of the group who were professionals, but they were more than professionals. They were giving of their own time, late afternoon meetings, a lot of evening work, I'm sure, to help put together the tools that we needed to. And I know it's made a real difference for kids all over our state.
It's an honor, I think, just to be recognized by the Diabetes Association. And there's so many key individuals that I've come to know over the years that I so respect, people that have mentored me in diabetes and that I've worked with side by side. And to be acknowledged by this group is key.
We need to really work together to make sure there's a plan in place and that plan is acceptable to everybody.